After a very public hotel stalker scandal, Erin Andrews revealed this week that she has faced another battle recently against cervical cancer. The Fox Sports sideline reporter says that she underwent 2 surgeries back in the fall before the doctor told her that she didn't need chemo or other treatment. The health scare didn't slow her down, though. She returned to work just days after each surgery. Well, this news comes on the heels of a new study that found cervical cancer death rates are much higher than previously thought. Joining us this morning to break down the study is Dr. Shafer. He's a gynecological oncologist and with Hartford Hospital. So first, thank you for being here.
Thanks for having me.
Let's dive into this study. What did this study say? What did it find?
This study showed that the death or mortality rate from cervical cancer was higher than we previously thought. What they did was showed that when you remove women from who had a hysterectomy, therefore their cervix had already been removed for other reasons early in their life, that when you took those women out of the calculation, that the actual number of people dying from cervical cancer was higher than we thought. In addition, the more possibly important part of that study showed that there was a higher gap between white women and African American women. Specifically, that African American women were dying of cervical cancer at a much higher rate than white women were when you, again, controlled for those who had already had a hysterectomy and therefore their cervix had already been removed. And this shows that there's a disparity in how either women are diagnosed with cervical cancer, treated, or just their access to care.
So I was going to say that's the reasoning behind this disparity. It still needs a little bit more research about exactly why, but
yeah, that's a really good question, and it's probably multifactorial, and the authors of this study didn't go into find a cause for that disparity, but it's thought that A, there may be less screening of cervical cancer among minority and specifically African American populations, or B, that these women, even once they're screened, the follow-up rate may not be as good, and then C, there's some concern that just the disease has a different course in African American women, and just the biology, either more aggressive histologies, so types of the cervical cancer, or the way they're treated once they're diagnosed, or where they're treated, whether it's a comprehensive cancer center or not, might also influence that disparity.
Interesting. I want to get back to Erin Andrews for a second, and this news that she just made public. I know that you specifically don't know her case, but have been reading up on it yourself. What does this say about early detection?
Sure. Well, I think, again, the fact that she only required surgery, apparently, and does not require any other therapy, namely chemotherapy or radiation, suggests that she was found to have early stage disease, which is good, because cervical cancer, when caught early, is very treatable. And the way we identify and catch cervical cancer early is through screening, and namely that's a pap smear. And so, there are the guidelines of exactly how often or when to have pap smears. Right. Those change a little bit over time, but routine screening almost always will catch cervical cancer early. And when it's caught early, it's very treatable.
Yeah, and I mean, the guidelines are different depending for women on your age and some
Absolutely.
of your risk factors and all of that. What about treatment? If you get that diagnosis and you catch it early, what treatment options are they? How effective are they?
So for early stage cervical cancer, it's almost always surgically treated. And depending then on certain risk factors that the tumor looks like, size, and other things, that would determine whether or not a woman might need what we call adjuvant therapy, so things like chemotherapy, radiation afterwards. Later stage disease is usually treated with a combination of radiation and chemotherapy, which can be very effective. It's just that, like most cancers, when caught early stage, stage 1 or stage 2, it's just the treatments are much more effective and have a higher success rate.
Last question for you. Knowing this study, knowing what we know about cervical cancer, what would your recommendation be to patients?
I think patients should see their doctors as regularly as possible, and if you haven't had a pap smear or haven't seen a gynecologist, definitely mention to your primary care doctor or seek one out. At Hartford Healthcare, we have cancer screenings at all of our locations: Hartford, New Britain, Bacchus, and Midstate. And I think that that's the most important thing. Screening does save lives, and early cervical cancer that's caught early is very, very treatable.
All right, Dr. Shafer, thank you so much for being with us this morning.
Thanks for having me.
All right.